Catch your breath. Catch your breath.
Oh, Jesus. So now I can't work. I can't drive. I can't, pick up my kid. I can't play with my kid. I can't be a wife. I can't be a mom. Just.
Oh my God. Hey everybody, Dr. Cipriano here. We're at our Tampa, Florida location. And today, this next patient is probably the craziest case I think I've ever had in my entire channel of what you guys have watched. The story on her, the backstory, the trauma she's went through, and now up to date, she's being like passed on from provider to provider to provider. In immense pain, has been dealing with this for years. I want you guys, you got to listen to her story, listen to what she's been through, listen to even what she's been dealing with through medical doctors, DOs, PTs, chiros, whatnot. This poor lady has been through it all. Tell me what you guys think. Leave a comment. Let me know what you guys think about this video and about everything that's going on with her. If you like it, definitely give me 2 thumbs up. I would greatly appreciate that. But just so everyone knows, yeah, we're here at Tampa, Florida location, and this is definitely by far, I think, the craziest case I'm ever putting out on YouTube today. Okay. So I was going over everything. What in the world happened? I'm seeing with the AS.
Yeah.
When did you find that out?
2016.
Okay. So 20, that's, okay, 8 years now.
Yep.
What do you...
So I have a bunch of stuff going on from cervical, shattered my coccyx as a teenager.
Okay.
Was almost murdered in my 20s.
Oh my gosh.
I had a stage 3 concussion, and then I was black and blue from head to toe, so God knows I never went over the records, never could look. I didn't want to look at the records to see what was said. So, yeah.
Oh my gosh.
Been in 5 car accidents probably, and then but it didn't seem to bother me. But in my 20s, and I did manual labor for like 15 years, so
okay,
that didn't help anything, especially because I started really young. My dad had a family business.
Okay.
So.
Oh my gosh, so you've been through it all.
Oh yeah. So neuro did check me out.
Okay.
And, Dr. Klaffner did everything that he needed to do, and he said, I'm pushing it back to your rheumatologist. This is definitely going to be in her wheelhouse.
Yep.
So they've just been band-aiding me for, decades, and I finally, my kidney and the LFTs were, the blood work was outrageously getting dangerous. It was getting pretty dangerous, so I just DC'd everything.
Okay.
And then I had my legs, my feet, and everything swell up, and that was a huge nightmare. So I went completely radical, and I was in bed rest for 7 days with my legs completely straight up in the air.
Yep.
And that did it.
Okay.
And then since then, I've just been pretty much on bed rest because I'm scared to death. First of all, I've got fecal incontinence due to the pain. I've had syncope episode and hospitalized because they thought I had a cardiac condition. When I tried to tell them, it was during a blood draw and she was fishing for the vein. And I was already in level 15 pain, and I'm like, I looked at him and I just heard, and they were like, what's going on, and I sat back down because I knew what was going to happen. And then I went out.
Lights went out. And
then they couldn't get my blood pressure back up and my heart rate back up. It's 42 is my heart rate. 44, okay.
Blood pressure was 66 over 44.
Oh my.
I take a picture of it because I knew they wouldn't believe me at the ER.
Yeah.
Here you go.
That's what you gotta do nowadays, because they don't believe you.
Yeah, correct, yeah. Oh my gosh.
Yeah. So then I woke up with one day, all of a sudden, with all these other things, and psoriasis, I have the rarest form, PPP. And So yeah, a lot of stuff going on. So I thought they would test me for psoriatic arthritis, considering, but no one's done that. I have to beg, plead, and borrow to get anyone to do any testing. And then if I do, I gotta tell them the code. I gotta tell them what it's for.
Oh my God. You gotta tell them their job.
I gotta tell them. I gotta give them justification.
Correct.
For a test. So.
Oh my gosh.
So the main complaints are right shoulder. If you can't bend your arm, because you can't.
I thought it was frozen shoulder. That's exactly how it acts. The ulnar nerve involvement, radial, distal. It acted just like it got real tight. Yep.
But
then I went to a neurofacial reset therapist, and so he's had hands on me now for a month. And he's like, oh my God, both hips have bursitis. He's like feeling my body, and he's like, but everything is pseudo. He's like, this is not frozen shoulder. He goes, now, is it acting exactly like it? Absolutely.
Yeah.
He goes, but that's not what you have. And he's like, same with your hips. He's like, I can tell there's just lots of inflammation going on. So it's not like, and then all the other comorbidities that go with metabolic syndrome.
Yep.
So, woke up it started as a bad migraine. I have chronic migraines, so I thought just another bad one, but 3 days it was still going on, and then I had projectile vomiting, and which I've never had like that. I'm like, oh, this is different. And then it started going down, and then it went through the shoulder blade, and then I'm like, oh, this is getting worse. And then it got the ulnar and the radial and distal nerve involvement, and then the dexterity started going. And I was actually in the hospital like this, in this much pain, but I was way more deformed, and they completely ignored it.
How could you ignore that?
They said they have to go, it's corporate now, so it's run by CEOs, not by chief of surgeries. So everything's about money.
Yeah, of course.
So they're like, you were admitted under a cardiac code. We are not touching anything but cardiac, the code you were admitted under.
Oh.
And I'm like, well, and the paramedics told me, they said, well, they're only admitting for cardiac or pulmonary, so which one do you want me to pick? And I'm like, what? I'm like, so you can't admit me for what actually happened. Fine. Put me under cardio, which didn't help me out, because then they just did all these, and they're like, oh yeah, heart's fine, clear, and I was discharged, and they never did anything about this at all.
This was just in January. This wasn't like years ago. This just happened. So it wasn't COVID.
Yeah.
I mean, the hospitals were still full in Orlando.
No, they're telling me they're taxed and they're all moving out.
But yeah, they just.
Because of all well, to quote one of the techs, she said the borders are wide open and we just don't have the resources. So most of the healthcare providers are moving out. I know there's only 2 going to be left. And they're hoping to phase out by 2025, so you'll have only Medicaid and Medicare, and maybe 1 HMO left.
Wow.
So, I'm like, I think maybe I'm from DC.
Okay.
So I'm not used to not having access to healthcare like this, but it all was tipped off. I was perfectly healthy, 120 pounds, great. I got norovirus.
Okay.
And then I got TMJ, then I got, the ear infections, and then I'm like, I've never had any of this stuff. And then the GI, and it was severe,
Yeah.
The GI doctor, he was a really good doctor, seasoned. And he was like, just inflammation. He's like, I don't even know what to call it up there. He's like, he gave me the pictures, gave me the report. And he's like, it's just bad. Everything. He goes, just put it this way, angry. Your gut is angry.
Yeah, not what you want to hear.
And since then, I've been to Mayo.
Okay.
They couldn't help me. they agreed the labs are off, but there's no specific diagnosis we can give you.
And they just let you
And then
basically on your way.
again followed up with another GI that was supposed to be really good, and now, to my surprise, I have GI dysplasia and all these other additional diverticulosis now, internal hemorrhoids, and all from it's all based on inflammation.
Yeah.
They've just been band-aiding. I'm like, this is getting out of hand. You guys need to find the cause. So I got to go through pain to get.
Yeah, but now they're still not. They're not doing anything. They're not even.
Resources.
Oh my gosh.
So she's only got.
They're running hospitals on staff that they shouldn't be running hospitals
Yeah,
on.
she just had for the first time acupuncture
Okay.
on Monday.
Okay.
That was a huge.
That was a game
Big
changer.
reaction to that.
Yeah?
Positive way, yes. So that definitely helped. She'll be going. She's got 2 more sessions.
Heck yeah.
So
Heck
we're
yeah.
going to be going this route now, I think.
But because I have AS and all the other stuff, I was on pain management for that.
Yep.
And then he stopped taking Aetna. You know, everybody wants cash. And I'm like, well, how much would it be for you to continue my SI injections, you know? And he's like, $7,000.
What?
And that's what we used to look at his bills to the insurance company, and he used to remark on them and go, what the hell? Why would he even he knows he's contracted at a certain rate. Why would he try to build $7,000 Aetna, you know? Or what it was United we had at the time. And when it switched Aetna is when he's like, nah, I gotta have cash. And then he's like, well, I'll med manage you. So then I was on the opiate thing that went on for 2 or 3 years, and that was nothing but a haze.
Yeah,
know
of
what
course.
I mean?
Oh, 100%.
And
Yeah.
I'm like, well, now I have a daughter and stuff. I can't be like this anymore.
No.
You know, so when I got pregnant, everything went away. It was like the best I felt ever was when I was pregnant. And my rheumatologist at UCF, she said, you know what? Most of my rheumatology patients tell me that is when they feel the best.
Really?
The ones that have like really serious conditions, she goes, they feel wonderful when they're pregnant.
Oh, there you go. Get pregnant.
That was fixed. One and done. 'Cause he had 3 from his late wife. His first
you name
wife.
her Mary because it'll be a Jesus thing.
Yeah. Oh gosh.
The only interesting thing I have noticed that I tried to do, even though it's painful, is how if I put my 2 shoulder blades together,
Yeah.
like take something gets released. I don't know what, but it stops a lot of the zingers.
Okay.
Now I let it go.
And it's holy cow.
So I've been trying to find. You gotta. I haven't been getting any sleep. I'm up for 3 days. It's not until my body gives out that I go to sleep. And I mean, he's given me everything that he's got, which you know is outdated. Flexeril, outdated. Tizanidine. I mean, from 2015. Yeah. Because they won't even give me a muscle relaxer. We don't have the medications. We don't. Yeah. To give out. So they're being real stingy on who they give them to, you know. And stuff,
My
so.
goodness. Wow. All right.
Yeah. So it's been difficult.
Oh my God, yeah. I could only imagine what you've been dealing with and going through.
Yeah.
And then even like you said, with chronic migraines to top it off, that granted GI is just all over the place right now.
Right.
And then this, like you said, with the shoulder,
Yeah.
just recently, what was it, January you said?
No, that's when she went to the hospital.
That's when she went to-
Shoulder started about almost 6 months ago.
Okay.
That's how long she's been dealing with this.
Okay.
And it kept getting worse, and I kept begging doctors, you know, but now, they can either take you or not take you. So when they reviewed my case, they would pass.
Oh, they looked at that and were like, yeah, she's,
That's not us.
yep.
You need a neurologist, you need an ortho, you need rheumatologists.
Yeah, they're punting her off everywhere, every which way.
They're 3 months out.
Yeah.
So it's taken us just until recently to start to get into all these providers.
But he's been watching you for a long time on the YouTube.
I mean,
And so finally my the guy that does the neurofacial reset, he's like, honestly, I've done as much as I can really do.
Yeah.
He goes, I suggest a chiropractor, but I would only go to one that you know is really good for somebody like you.
Yeah.
You know, don't go to just anybody that, you know.
No, I hear you.
And that's when he made the appointment and surprised me.
Okay.
But he's just messed up. He's got other issues. Yeah.
Now with the AS, how has anything starting to fuse yet, or
I don't know.
is there any movement in the neck? Because
It's hard. Range of motion is getting pretty limited.
Okay.
but after the acupuncture, it was fine. It was normal.
No way.
It was completely.
I felt like I was like in my 20s again.
She reset all kinds of things, and it lasted almost 24 hours.
And I have nausea all the time, and nothing has gotten rid of it, but that got rid of it for 24 hours.
Get out of
And when
here.
it came back, I mean,
It came back with a vengeance.
yeah.
Oh my.
Just like, and all I was doing was like, you know, something.
You know,
I can't do much.
You know
what I mean? I can't drive anymore. I can't like pick up my kid. I mean, yeah. So she's
quality of life is.
upset about it.
Yeah.
We've had to have teacher conferences about it because she's gotten upset, you know. Because she sees me not getting any help, you know, because we have to bring her with us on some appointments,
Yep.
you know, depending on when she's at school and stuff like that, so.
Oh my gosh. I mean, this is just completely like 180'd your life and.
Oh, yeah. Yeah. Yeah, basically, if you want help, you gotta pay us cash, you know.
Well, I mean, it would be one thing if it was a reasonable amount. But I'm sorry, even like for me, someone that says $7,000, I'm gonna let you out of your mind?
Right? Yeah. That's...
Like,
8 years, but I'll continue your med management if you want to pay, you know, $200 a month.
at least, yeah, but you know what? At least that's a reasonable,
Yeah, so,
but.
Can you put me on a protocol to wean me off?
Yeah.
No, I'm not touching you now.
Oh
No.
my.
Then he didn't want nothing to do with me, and I'm like, are you kidding me? You're a pain management doctor.
Well, they want to keep.
He goes, you could abuse it. I'm like,
You're asking
you have me on Oxycontin and you have me on 40 milligrams of Percocet a day. I don't think Suboxone is going to be the problem. You know?
And you even said you asked them to wean you
Yeah,
off.
Yeah, they don't want to.
No, because then you're not a customer anymore.
Well, no, what it is it's liability. Then he's the one he's the one that's been prescribing it for 3 years, so it's on him. You see what I mean? Then he's got to admit that he's having to wean his patients because he's overprescribed. You know what I mean? So I got it. I understood what he meant by I can't help you. I'm just like, I wasn't expecting to hear that.
That is absolutely awful.
I was like, okay.
Wow.
So I just went off of it myself. I mean,
good for you, but I can only imagine the pain that you're like having. I mean, with getting off of that, obviously, I mean, it's numbing, it's blocking nerve roots, it's blocking, and then getting off of it, the pain is probably.
yeah, then you become hypersensitive. But I went off of them in 2021.
Okay.
So I've had a few years off of them.
Okay.
Which is good.
And I know, like you said, at least the clarity now is there, but now the pain.
You don't even know how cloudy it is until you know, and you get out of that, and then you're just like, oh wow. And I'm like, I'm just refusing to go back on that route, you know.
Oh, I don't blame you.
No way. So I have a cannabis card.
Okay.
That's it. So that's all that I've been allowed.
Okay. Any help with that? Like any change with that? Do you notice?
Yeah, the RSO.
Yeah.
But you know, it was at the point where I was having to consume quite a large amount.
Well, the amount of pain that you're in, of course, it's kind of goes hand in hand.
I'm like, I remember there was a student doing my epidural when I gave birth, you know, and she missed it twice, the first 2 times to the zinger. And I mean, it's like, it hurts you so bad. Like my first reaction went, and I was like, oh, I can't punch her. I was like, please don't do that again, okay? And then she did it again, and I'm like, okay. Yeah. I'm like, can we get a doctor in here? And he's like, look.
That happened to my wife too.
Let her do it one more time. If she misses, I'll do it. I said, all right.
Yeah, and they're trying to tell you to stay still as you're contracting and whatnot. But yeah, you got to stay completely still. And oh, here's a big contraction. All right, let's go. Yeah.
And I would take that pain any day.
Wow.
Any day. That'd be a piece of cake. That'd be a cakewalk. Yeah, at least I could function, you know, but with this.
Jeez.
Because now I can't work, I can't drive, I can't, you know, pick up my kid, I can't play with my kid, I can't be a wife, I can't be a mom, you know, just.
Oh my God.
And then the short-term memory is just awful.
Oh.
So I'm assuming that's because the pain just turns off anything that's not vital.
Your brain is trying, it's on overload, it's working too much, the signals are getting sent way too much, and it's focusing more on pain. So yeah,
I'm
simple
like
every day.
And I'm like, what were we talking about?
Oh my God.
I have no idea what we were talking about. Mid-sentence.
Oh.
And this is daily, all the time.
Oh my gosh. All right, we need to get you some relief.
Yeah.
Oh my gosh, yeah. I'm gonna have you just stay sitting just like that.
Acupuncture are the good answers, I think.
Well, I'm glad that the acupuncture has helped that much tremendously. That means a lot, especially with what I'm going to do too.
Oh, okay.
Knowing that I can imagine we're going to get a crazy bit of relief today.
That's what I'm hoping. I was shocked at that. I'm still gobsmacked that it did that much.
And you know, if you were to go to an MD or a DO they
say toka, they don't do nothing for you, they're quacks, you know, and stuff like that. And
but that has given you more relief with that 24 hours in that period than any other.
Yeah.
But the acupuncturist is a quack, right? Go figure, huh?
Well, this stuff's been, you know, the Eastern medicine, how many thousands of years has like acupuncture been practiced and what you do?
Yep.
How old is Percocet?
Correct.
You know, or even go back to penicillin.
Yep.
Okay, compared to Eastern medicine.
Apples and oranges with that.
That's what my MD told me years ago. It hasn't been around for thousands of years because it doesn't work.
Mm-hmm.
No, it didn't.
Jeez. Now with me just pushing in like this, what are you feeling?
Just pain in my neck, my traps, my shoulder.
Okay. And then I know obviously the good arm, you got no problem. This moves all around, no issue.
Nope.
Now this one.
It's just that this side of my body, I also had OCD, Talerdome.
Okay.
So I have this ankle rebuilt.
Okay.
So it was first diagnosed when I was 12. It's just that my parents never had health insurance on me, so it never happened until I was older. And I couldn't walk. I was wheelchair bound. So they rebuilt that ankle. And so my left side of my body has had to compensate for most of my life for this, right? And I think that also contributes to a lot of issues.
Oh, 100%, because now you're overworking.
And now I'm overworking it again, right? Because I went through a year of physical therapy to get right. And then all this stuff happened.
Oh my gosh. Now, yeah, obviously you can tell all of this is all just hiked up, and even I'm lightly, and you're feeling this just with me.
Yes.
And then the movement on this side. You see the grimace in your
Oh, you can see how much your right shoulder's
let that rest.
jacked up versus the left.
Oh, 100%.
The left acupuncturist, her right shoulder was actually lower and relaxed more than her left, which just physically looking at her was amazing.
Oh
Her
my.
arm was straight down. She wasn't guarding it anymore.
Yep. Let me know how this feels. Is that all right? Okay. Start up top here. Yeah, it's all when we get in the hair super, super tight. Okay.
Super, super sore.
Alright, I am gonna have you lay face down on the table for me. Yeah, I know that arm's... Oh, okay, alright. We got them at least both to go straight. Yeah, there's so many spots, literally going from cervical through thoracic and lumbar.
That's what I try to tell people, and they're like, no, there's no way.
Oh my gosh.
Sad. Jesus Christ.
Let me feel. Okay. What are you feeling with that arm?
Sometimes I can try to manipulate the neuropathy.
It's zinging down?
Yep, yeah. I know your job's easier if I'm relaxed. With the zinger, there's no way.
Yeah, I hear you.
Ow! Jesus.
Yeah, good. Catch your breath, catch your breath. You're gonna have a love-hate relationship with me today. Hate me at times, but love me too. Deep breath in and out.
Oh, God. Why is it doing that? Jesus.
It's moving, we're moving everything around.
You sure you're moving it the right way?
I am.
Okay.
I am sure. Let me have you, let's see if we can do this. Let me have you sit up on the table.
Okay.
And then I'm gonna have you bring, like straddling the table, one leg on each side. Yep.
Yeah.
Try sliding. Like you're just. There you go.
Yep, yep, yep.
There you go.
And then we're gonna bring that leg on this side.
Oh, yeah.
Take a second if you need, you're good.
Oh, my God. Oh, my God.
Breathing.
And breathe.
Been needing that for about 25 years.
Good.
Still counting.
Oh yeah. All right, so we're gonna have you go face down again for me. All right, I am going to stabilize right here on the sacrum. I want you to try to raise that leg up as high as you can. Okay. What do you feel when doing that?
Pain here.
Okay, so pain going to the left side.
And then just really weak.
Okay.
And then I feel pain in the hamstring.
Okay. Relax that leg. Do the left leg now. A lot better. Okay. What do you feel when you raise that left one?
It's tired. I feel like it's just, I have much more mobility, definitely, but it just is fatigue.
Okay. What I want you to do, I want you to cross your right foot over your left foot for me. Good. Hold it there. There we go.
Can you keep it there?
You want me to keep it crossed?
Yeah, good. One more. And rest, yeah. You can relax, you can relax. Bend that knee. Last one. Catch your breath. Catch your breath. 2 more. Catch your breath, catch your breath. These are the worst of everything that I'm doing today, just so you know. Last one.
Oh my God.
Catch your breath. Raise that leg up again. It's actually up there. I don't know if you can tell. What do you feel?
There's some pain going.
Okay, so it's not over here anymore.
No.
Because the first time you had it all the way over here.
Yeah.
But you're actually raising it. You didn't even get your thigh off the table last time. Good. Okay. Let's get you to flip onto your back, and I'll help you. Perfect. There we go. Good. Ooh, I felt that one come right up and out there. Reset that ball and socket joint there. Good. I'm going to actually get your assistance with this one. I'm going to slide you down on the table here. Good. And then I want you to just hold down some pressure there. Lift up and down. Now with this, we're gonna decompress the spine here.
Where do you have my hands?
Just where they are is perfect. Catch your breath. And breathe. Deep breath in and out. What did you feel?
Pain. A lot of pain.
Oh, I believe it. Everything has just been compressed. So many areas that were fixated, out of alignment there.
That much for it.
You got it's like hitting the reset button. You gotta wait for the
hated you at first. Now I started to love you again.
I've seen a lot of these, so I know how this goes. Yeah, it's a shock.
Oh yeah.
Did you feel it all the way? Yeah, that's good.
Well, not my feet. I felt it down, to the sacrum, the coccyx. Yeah, all the way. Yeah.
And then here's the part where you're gonna hate me again. We're doing another. Just rest.
We're back.
Yep. Just a little bit.
I didn't know if I was holding her enough or
Oh, that was perfect.
just keep her. Okay.
Yeah, that
I
was.
didn't want to keep her from.
Yeah. No.
Okay.
You were good. Breathe. Catch your breath. What did you feel?
A hell of a lot of movement. An extraordinary pain. It's like until it settles all back down,
Oh yeah.
Oh, sorry. I sound like a freaking horse. It's just a sound. That's just the look I was going for.
Don't worry, he's only got like 100 subscribers, so.
Yeah.
That's a lot.
Yeah.
Is it better now? Settling. Okay.
Good.
I just accept it to be painful. But now I get, because you're fighting against everything that's been done wrong.
Yeah.
So,
I imagine it's different for
I'm gonna help you sit up.
too.
Rest.
Yeah.
Look at the shoulders.
I see that. Yeah, your right shoulder is lower than your left shoulder
Yeah.
again, like it was from the acupuncturist.
and the nerve pain went away.
The pain went away?
Yep.
Good.
I don't feel nearly as much tension or tightness in my traps. Yeah. I think my neck's just either atrophied or it's tired.
You gotta realize you've been activating all this muscle group for non-stop. Literally non-stop. The only time you had a break was from the acupuncture, so you got this 24-hour break.
Yep.
Besides that, oh my gosh, everything is gonna be so tired. Overused.
2002 was the first time I went to a chiropractor for my neck pain.
Yeah.
And he said, you have arthritis, so you're gonna have neck pain. And I said, is it normal for somebody at 24 to have arthritis that bad in the neck? And he's like, oh yeah, you get arthritis as you age. I said, oh, okay. I did 6 adjustments, if that's what you want to call it, and nothing. And he said, well, carry a lighter purse, and sent me on my way after $800.
Carry a lighter purse.
He said, your purse is too heavy. He picked it up and said it was too heavy. And then asked me which shoulder I carried it on. And I said,
Oh my God.
I said the right.
Okay, to an extent, I do agree.
And it is too heavy, yeah.
To an extent, I definitely do agree, but oh my gosh, after 8 sessions, that's the conclusion.
No, it was only 6 for $800.
Finish though.
Okay, well, at least you're smiling, so.
Yeah, everything's moving easier.
Your arms are down. They're not. When you came in, that one.
Your right's lower than your left right now.
Yeah, you had like the little baby bird wing going on.
I know. I told him, I said, just cut this thing off. It's useless for me now. But
How does it feel? Just movements and.
a lot better. Because I had rotator cuff involvement too, so it was kind of grindy, you know, and it's not like that at all now. But the biggest deal is having all those zingers is gone.
Not feeling any zingers going down that arm.
No, if I do, it's so mild, you know, for me, for being in that much pain, you know what I mean? Like, one notch of an improvement is like, okay, so that's radial, yeah. So that one's still, that one never, that's my little, but what I do, oddly enough, and I don't know why, but if I put my heating pad and wrap it on it, it'll help with the neuropathy pain, but I have to put the old school one that's really super duper hot.
Yeah.
To get the pain to stop. But what I'm wondering if it's like deferred pain, because he took the heating pad off one night, I fell asleep with it, and I had burns all over my arms, but I couldn't feel them because the neuropathy pain overrode that pain, and I was like, oh. He's like, oh my God, what are you doing? I'm like, well, I could. He's like, don't you know you're burning yourself? I'm like, no, because you don't know how much pain I'm in. That kind of, it's funny, the brain's a funny thing.
It really is.
I guess it just overrode it. It was like, nope, this is more important.
Yep. How do you feel standing up?
Okay.
Notice the difference when you...
Oh yeah, there's a difference for sure. Definitely.
Yeah, you're walking actually a lot straighter. When you came in, it was almost kind of like semi-fetal position. Just that's the position the body goes to when you're in pain.
Okay.
I don't know, pull your legs up. That's just.
That's why. Okay.
Yeah, it just happens, and now you're actually upright.
Oh, yeah, I couldn't do that before.
But yeah, that was amazing.
I think that was a big shock to your body.
Oh yeah.
Everything, especially the Y-strap.
Today is going to be the day. A lot of water,
Okay.
rest, relax. Granted, I know you've been basically bed rest for years now.
Yeah.
Oh yeah, I have breakdown of tissue and bacterial and fungal infections of the feet because they're like, we only have to treat what's emergent.
Oh my gosh.
I'm like, okay. But I had one nice nurse, so she got me some booties.
Dude, even now, like just watching you, you're standing off on one foot at a time.
Oh, my knees are really, sometimes this one will blow up. I'll wake up and I'm like, oh, Jesus. You know, it's like, but yeah, my knees feel great. And then this ankle feels better. And you're the only one that's gotten the ankle better. I was afraid because of all of the edema that I had at that one time, because it has always been painful since then until now.
Yeah.
So now, whatever you did, it's right.
Yeah,
I'm like, oh my God, I can move my ankle again. Because, yeah, after all that hyperlipidemia, it made it so I was having a significant decreased mobility in that ankle.
your hips.
And my hips feel a lot better.
Hurting with your hips.
That right one really moved with that leg pull. Pulled that femur head, clicked right in and out, just reset it.
Nice.
Feels weird being able to.
It's very different, yeah. It's kind of like how I felt after the acupuncture. You kind of get godsmacked when you go from a level 10, down to even, right now I would say I'm down to a 5, and I'm always at almost passing out. I always have to constantly be putting my head in between my legs all the time.
Oh.
If I do stand up to move around, I have to constantly. Or run to something I can go like this to.
Yeah. How old is your daughter?
7. She just turned 8 on the 25th of March, so.
I'm gonna say she's gonna see a big difference in you. And this isn't just gonna be a 24-hour.
Yeah.
But I definitely.
I need to maintain it because I do. It's with the metabolic, syndrome. Definitely don't want it to progress, and then the AS. I gotta keep that in check too.
Yeah. No, this is how you need to be feeling and moving. Trust me.
I feel like I can even inhale more.
Oh yeah, I hear that a ton. Just the breathing. When you get everything aligned and pressure off those nerves, the nerves that are going right into the lungs to the heart, and that opens up and there's no blockage. It's like because obviously we didn't change the capacity and the amount of air. You know what I mean? It's just
I'm like, I can breathe a lot deeper. It's great. Thank you.
You are welcome. Yeah, this is where you need to be. Trust me, even tomorrow, I can already tell you'll be a little bit sore, but sore in the sense of I just rocked you,
right,
really good,
right,
kind of sore. But you'll be moving. You'll get sleep tonight.
Perhaps.
You'll get sleep tonight.
I'm bored of that.
But yeah, this is where you need to be.
Oh my gosh.